Hey, what's up everyone? Chris again. We're back with another student medical assessment. Like we have before, this is one of our students running through a medical assessment. So grab your skill sheets, follow along, and a big shout out to Blue for being in the video.
Ready? Ready. All right, you're dispatched to a local restaurant for approximately 60-year-old male, difficulty breathing.
Okay. All right. So, BSI, is my scene safe?
Your scene is safe.
Okay, so I'm gonna determine the nature of illness. So, it sounds like you're having difficulty breathing?
Yeah.
Okay. I'm gonna determine the number of patients. Is this my only patient?
This is your only patient.
This is my only patient. All right, cool. At this time, I'm gonna request additional EMS or ALS intercept. Mm-hmm. And by the way that the patient's sitting in the tripod position, I'm not gonna consider C-spine.
Okay.
So I'll get into my primary assessment. General impression of the patient.
Yeah, as you walk up, he's sitting in a chair in the modified tripod. Looks like he's having a very hard time breathing, and he will acknowledge your presence as you walk up.
Okay. So I will determine the patient's level of consciousness or level of responsiveness. So it looks like the patient's alert. So the patient seems to be alert. Hey, sir, my name is. I'm an EMT. What seems to be going on today?
I can't breathe.
Okay. So, do you know where you're at?
Yeah, in Boise.
Okay. Do you know what year it is?
2025.
Okay, and what were you doing that led to this event?
Eating dinner.
Okay, so seems to be the patient's A&O times 4, and the chief complaint, I'm going to determine the chief complaint is just respiratory distress, difficulty breathing. Is the patient's airway open and patent?
He's talking to you.
He's talking to me, okay. So now we'll get into breathing. How's the rate, rhythm, and quality of the patient's breathing?
He's breathing at 22 times a minute, labored with normal chest rise and fall.
Labored with normal chest rise and fall. How about lung sounds? I'm going to listen to his chest. What do I hear? Do I hear any specific?
There's wheezing in all
There's
4.
wheezing in all 4? Okay. At this time, I'm going to put the patient on a non-rebreather mask, 15 liters of oxygen per minute. And I'm going to begin checking the patient's circulation. So off the bat, do I see any external bleeding?
No bleeding.
No bleeding. I'm going to check the patient's pulse.
Okay.
Can I have a rate, rhythm, and quality of the pulse?
Yeah, so he has a strong, regular pulse.
Strong, regular pulse?
Strong, regular pulse.
And skin signs, the patient's color.
He's pale, cool, and clammy.
He's pale, cool, and clammy. Temperature, is the patient hot or cold?
Feels normal.
He feels normal.
Yeah.
And the condition, is he sweating?
Just clammy.
Just clammy.
Yeah.
Okay, you did just say that. So at this point, I'm going to make this patient a high priority patient. It seems to be that the patient, I'm going to make this patient a high priority patient. I will also get a baseline set of vitals. So could I please have the patient's blood pressure?
Okay, blood pressure is 90/54.
Respiratory rate?
Respiratory rate of 22.
22. Pulse?
Pulse of 115.
Blood glucose?
108.
And a SpO2.
SpO2 of 80%, but improving slight with your oxygen.
Okay. So I'm going to try to obtain a sample history. So, sir, are you allergic to anything?
Cashews, yeah.
Cashews? Do you take any medications?
I have an EpiPen.
EpiPen?
Yeah, and I take something for blood pressure.
Do you know what it's called by chance?
It's a really long one, hydro something.
Okay. Is it for high blood pressure?
Yes.
Do you have any pertinent medical history that I should know about?
Just what I told you, the blood pressure.
Okay, the blood pressure and your EpiPen.
Yeah.
Do you have your EpiPen on you?
It's out in my car.
It's out in your car? Okay. When's the last time you ate something?
I was eating dinner.
Eating dinner?
Yeah.
And you ate some cashews probably?
Maybe I was kind of trying everybody else's meal.
Okay.
So
roughly 5 minutes ago, maybe 10 minutes ago?
yeah, 5 or 10.
Okay, and you're just events leading up to this, you were just at dinner, trying everyone else's food?
Yeah.
Okay. So at this point, I'm going to determine that the patient is having an allergic reaction. And his EpiPen's in the car, so I'm going to administer him some epinephrine, 0.3 milligrams of epinephrine intramuscular. So some clarifying questions. So you said you were just at dinner and you were eating everyone's food,
Yeah.
correct? Okay. And you happen to be allergic to cashews. Are you sure that you didn't eat any cashews or anything? Or do you know of, or did you see any cashews while you were trying everyone's food?
I don't know. Yeah, maybe there was something in the sauce, but
Maybe there's something in the sauce.
yeah, I'm not sure.
Okay. So for my interventions, yes, I administer him 0.3 milligrams of epinephrine intramuscular, and he's on oxygen, high flow via non-rebreather mask at 15 liters. So right now I'm going to we're going to reassess him. I'm going to determine him. Well, he's talking to me, so can I get vital signs?
Yeah.
After all his interventions, what
Sure.
are his new vital signs?
Yeah, so now you have a blood pressure of 100/60, respiratory rate of 18, pulse of 100, and his SpO2 is at 94%.
What about his blood glucose?
108.
Okay. So his blood pressure's low. I think this patient is a unstable patient. I'm going to reassess him every 5 minutes and get vital signs every 5 minutes.
Okay.
And then we're going to report to the hospital.
Okay.
Hospital, this is EMT1.
Go ahead.
Hospital EMT1, I'm bringing you a 60-year-old male with difficulty breathing. He has a chief complaint of respiratory distress. He has allergies of cashews, Medications he takes is epinephrine and blood pressure medications. He was at dinner and was trying everybody's food. I have given him 15 liters of high-flow oxygen via non-rebreather mask and a dose of epinephrine, 0.3 milligrams of epinephrine. His vital signs are as follows: 100 over 60 for blood pressure. His respiratory rate is 18. His pulse is 100. His blood glucose is 108, and his SpO2 is 92. We will be to you in about 10 to 15 minutes. I'll copy.
Perfect. All right. Anything else you'd like to do?
No, I don't think so.
All right.
I don't know.
Cool. It's a good job. You passed.
Okay.
You got it. Anaphylactic reaction to the cashews, right? The only thing where you missed some points as far as your secondary assessment and your reassessment.
Yeah.
Just we want to look for rashes and things of that on the
Okay.
skin, right? I mean,
Yeah.
we have enough to where we are affecting 2 different body systems, but we just want to make sure that we're being thorough with our
Right.
assessment. And as far as your reassessment, right, we listened to lungs, they were wheezy.
Oh,
So
yeah.
anytime we do something for a patient, we want to see if it's working or not working.
Right.
So we're going to reassess the lungs
as
and
well.
see if they're, if they're still wheezing or if they're clear now.
Right.
Same thing with like skin and work of breathing. We did something, we want to reassess. So is his
Right.
breathing easier?
Not just the vitals, but physically.
Right. How does he
Okay.
look? Does he
Okay.
still look like, or does he still,
Okay.
are we going in the right direction?
Right. Cool.
Make sense?
Yeah.
Cool. Yeah.
The only thing that threw me off, I'd say, was the blood pressure.
Yeah, so remember like anaphylactic shock, all of our
Anaphylactic.
vessels dilate and everything, so we
Right.
get that low blood pressure, high heart rate.
Right.
We
Okay.
gave the epi, and we're starting to go back up.
Okay. Okay, cool.
Cool.
Yeah. I passed?
You did? Yeah.
All right.
Good job.
Thank you.
All right, everyone, that was another medical assessment. Hope you learned a little bit. Hit that subscribe button, give us a thumbs up, and we'll see you later.